Treating clinical depression.
Biomedical treatments of depression. Medication.
Medication is the most common treatment for depression. Antidepressants increase monoaminergic. Monoamine oxidase inhibitors, MAOIs. Selective serotonin reuptake inhibitors, SSRIs.
Pros. Antidepressants are very simple, cost-effective, and constantly improved treatment. Faruqui et al. 2003 reviewed 35 studies and found antidepressants superior to placebos.
Cons. Drug therapy is hard to adapt to individual needs. Beneficial effects are not felt before estimated 2 weeks. Can be difficult to persuade patients to keep taking them. Medication must continue after improvements. 50% relapse if patients stop taking them. Antidepressants can be lethal in overdose. Danger for suicidal patients. Kurish et al. 2008 found second-generation antidepressants like SSRIs work no better than placebos for most patients. Accuse drug companies of suppressing research evidence.
Electroconvulsive therapy. ECT are thought to affect neurotransmission. The use of ECT rose again after the mid-80s due to disappointment with new generation antidepressants, improvement in ECT procedures.
Pros. Sackham 1989 reviewed studies of ECT, finding real treatments more effective than stimulated ones, and ECT more effective than medication, though medication is required post-treatment. Paguin et al. 2008 compared studies of ECT, placebos, and antidepressants, finding ECTs the most effective, including for severe and resistant forms.
Cons.
The effects of ECT, such as memory loss, are more severe with children, the elderly, and pregnant women. ECT should not be used for such people, unless as an absolute last resort. ECT has high relapse rates. Sackheim et al. 2001 reported 84% of patients relapsed within 6 months.
Deep brain stimulation. Mayberg et al. 2005 reported on a groundbreaking intervention for treatment-resistant depression. Application of chronic deep brain stimulation to Brodmann area 25. Brodmann area 25 is thought to mediate thoughts and emotions. Elevated activity in this brain region has been shown to be associated with depression.
Pros. 6 months after the study, 4 of the 6 patients still showed positive antidepressant response. 3 of them achieved remission or near remission of the illness.
Cons. Such intervention is still experimental. It is only intended for very severe and treatment-resistant cases.
Individual treatment of depression.
Individual behavioral treatment.
Examples of purely behavioral treatments for depression. Social skills training. Behavioral action therapy.
Pros. The behavioral treatment is that it can easily be tailored to individual needs. Houghton et al. 2008 evaluated the effectiveness of BAT on 42 patients with self-reported depression, finding the treatment effective, tolerable, and with a low dropout rate.
Cons. Therapists using behavioral techniques should progress slowly so that patients are not overwhelmed, which would be counterproductive.
Individual cognitive treatment. Examples of cognitive treatments for depression. Reality check of depressing beliefs. Rationality check of cognitive errors associated with depression.
Pros. The Department of Health 2001 reviewed research papers on treatments of depression, behavioral, cognitive, humanistic, and psychotherapeutic, and found the CBT to be the most effective. Whitfield and Williams 2003 found CBT had the strongest research base for effectiveness.
Cons. However, cognitive therapy is also costly. Weekly face-to-face sessions. Possible solutions are group CBT, self-help version, like the Spirit course. Cognitive therapy is not necessarily suitable for all patients. Difficulty concentrating is common with depression. Medication can be necessary for cognitive therapy to be even possible.
Individual psychodynamic treatment. According to Freud, 1917, depression is associated with pleasurable self-torment. Psychoanalysis might help people become aware of an unconscious death instinct, thanatos. According to Freud, 1923, this self-destructive tendency disappears with normal development. and depression comes from an abnormal development of personality during childhood.
Pros. Psychoanalysis is comparatively soft treatment. For that reason, it comes with little risk.
Cons. There is a risk to the therapist will substitute a general schema, Freud's theory, to the patient's unique case. Loftus points out the risk of patients creating false memories of childhood traumas. Psychotherapy is a very long and expensive process. Little evidence of its effectiveness. Probably best suited for late maintenance step of a stage-oriented approach, minor depressive episodes.
Humanistic treatment of depression. Examples of humanistic treatments: existential therapy, logic-based therapy, philosophical counseling. A humanistic approach is the softer of all treatment options. For that reason, it is arguably the least potent, and actually carries a risk of downplaying the severity of the patient's incapacities.
Group therapies for depression. Group CBT. Group CBT generally involves a dozen patients and 1 or 2 facilitators meeting once a week for about 12 weeks. Group exercises are used to challenge abnormal thought processes and restructure them into normal ones. Practice and reinforce new behaviors, fostering self-confidence.
Pros. In case of depression, the group setting can be very effective. Sense of shared experience and support, vicarious reinforcement, convenient for reality and rationality checks, convenient for SST.
Cons. Some patients may need the privacy of a one-to-one relationship to make enough progress to be able to start a group therapy. The group setting may normalize abnormal emotions, thoughts, and behaviors. Patients may get negative ideas from each other.